What's up, guys? Today we're going to talk about the knee, most common knee injuries. We're going to talk about the ACL, we're going to talk about the meniscus, and we're going to talk about patellar tendonitis. One that maybe people haven't heard as much about, but is super common. Let's get to it. All right, so the one that most people have heard of is called the ACL. So that's a ligament inside of our knee joint. So if you move the patella, so the kneecap over, you can see inside here where the ACL is. Now it crosses with another ligament called the PCL. So they cross back and forth like this. PCL is going to stop the tibia from wanting to go back, and the tibia, so shin bone, and the ACL is going to want to stop the tibia from going forward. So whenever they're checking it, they will put you in a little bit of flexion and they'll pull and test to see that. So if you see an athlete on the sideline, they may be doing that test right there. Okay, there's one called the Lockman's and there's one called the anterior drawer. Very similar, different degree of angle, doesn't really matter, just checking to see the integrity of it. So, as many people know, the ACL is commonly injured in athletics. So, football, soccer, basketball, rugby, really anything where somebody has to stop and cut and change direction. You're putting a lot of force on the ACL, and if you don't have good control through your hips, you end up tweaking it. You may have a ACL sprain, or it may be worse, and you may have a tear in it or a complete tear. So, if you no longer have the ACL, you can have some instability in that joint. Technically, you don't need your ACL. Technically, you can get along fine without it. I have a coworker right now who potentially has a torn ACL, but she's doing fine. She may feel a little bit of shifting in her joint, but she doesn't do anything too crazy that really causes an issue. Now, if it is an issue and it's causing you to feel like you can't do the normal things, you might want to go see a surgeon and see what's going on. Maybe the instability is because your ACL is no longer intact. Most common in athletes, but it can happen to anybody. If you step wrong off the curb, or if you're getting out of the car and you move in a weird way, if your ACL has already been strained or maybe already has a partial tear in it, it could take it all the way. So you may want to go get it checked out. The second injury that's really common that a lot of people have also heard of is the meniscus injury, a torn meniscus. But what is a meniscus, right? We know it's on our knee, but where is it exactly? Well, it's on the inside. So when you move the joint again, and you look in through here, it's this concavity that sits where the femur sits on top of it. It increases that surface area and gives you better contact. Well, if you end up putting a lot of force or loading that knee and you end up twisting, you can get a tear in that meniscus. We have what we call the medial meniscus, so on the inside of the knee, and then the lateral meniscus, so on the outside. Okay, so if you've been diagnosed with one, you may have been told you have a tear in your lateral meniscus or your medial meniscus, so that'll tell you where it is. Medial, lateral. Lateral's on the outside. All right. Meniscus tears are pretty common. They're also common in athletics, so we know we're loading that joint, we may be twisting, but it can happen just turning around in the kitchen. I had a patient once who was coming in because he was in the kitchen cooking some food, he turned and he felt this weird pop in his knee and he didn't know what was going on. Came in, did some tests, it was positive for a meniscus tear. He didn't do an MRI, but all the signs and symptoms were there. He had joint line tenderness, so he had tenderness right across this area. He had some clicking and some popping and some catching, and the special test I did to see if it would pop positive was also positive. But it was minor. He was able to do some exercises and stabilize his knee joint. He didn't need surgery. He was okay. Not all of them need surgery, but some of them do. So you may want to go see a trusted orthopedic surgeon and find out if that's what you need. If you need surgery, go get surgery. But know this, it's about a 50% success rate. Now, that number may have gone up in more recent years, but it's still something that you're not guaranteed to not have future problems with. But if it's really killing you, you can't do your day-to-day things, go talk to a doc. Get it figured out. See what you need to do. Okay? And it can get better with therapy. We do a lot of stuff with meniscus injuries. We do a lot of things to try to get that better. The last knee injury that's pretty common, but a lot of people don't know about it, is called patellar tendonitis, or truly a patellar tendinopathy. What that just means there's an issue with the patellar tendon. What's the patellar tendon? It's the one that's right below your kneecap. So technically, this is all one tendon. You have your quad tendon and you have your patellar tendon. Your kneecap sits inside of it, so that creates a separation between the two. So a quad tendon issue would be here, a patellar tendon issue would be here. So this is really common in both athletes and non-athletes. What ends up happening is this tendon becomes overworked. And a lot of the times that's because you're not using your glutes in the right way. So whenever we're bending our knee, often we're bending our hip and controlling our hip. If we're weak in the hip, we end up loading our quad too much, and that quad you'll put tension through both your quad tendon and your patellar tendon. So what you have to do is you have to unload that a little bit. In the short term, some people will do taping. They tape it to try to get that patella to not have any issues along the where it slides in the groove. Some things that they do in the short term is taping. So they may tape that patella to give it a little bit more space so it's less painful. But in the long term, you need to be getting your glutes stronger, getting your hips stronger, being able to propel more from your hips and do less through the knee. So with patellar tendon issues, you really want to get the glutes stronger. And actually, with all of these injuries, whether it's your ACL, the meniscus, or your patellar tendon, it really is coming from the hips. If you don't have good hip stability, if you're not strong through both your what we call glute max, so your butt muscle, or your glute medius, smaller muscle but still equally important when it comes to stability, then you're going to have issues elsewhere. You may have issues in your back because you're not stabilizing through your hips. You may have issues in your knees or your ankles because you're not stabilizing through your hips. Wherever you're having pain isn't always where the true problem is. It's just a symptom that's popping up. So we got to find the true issue. So it could be your hips. So the best thing for you to do is to get stronger in your glutes. Take a look at the links below. Take a look at my channel. Look at the playlist for glute strengthening. I have a ton of videos coming up and more are going to keep coming so you can learn more about strengthening your hips and getting a little bit better. So there's plenty of exercises for you to choose from and see what works for you to help get more stability through your hips and to get stronger there. Okay, let's take the pressure off the knees and let's stabilize those hips. So if you liked what you saw today, click that like button. If you had any issues with your knees or you know some tricks to the trade that may help people, write a comment below. Help some people out. So thanks for tuning in, guys. We'll see you next time.